More quality time with your loved ones. As one nears the time to consider hospice care, the earlier admission, the more seamless experience it is. And you want that comfort to bring peace of mind and body during this time. Anastasia Russell is the clinical manager of hospice and palliative care at Southwest Medical Hospice and joins us today to break down the referral and admissions process. Good morning to you.
Hi, it's nice to be here. Thank you for inviting me.
Well, thank you for joining us. We appreciate your time. So let's go ahead and start. Who is eligible for hospice care?
Hospice is a benefit and a service for those with a life-limiting illness and a prognosis of 6 months or less to live, should the disease run its natural course. A patient opts for hospice when treatment is no longer an option or it's no longer effective. A patient is then given the opportunity to focus on quality of life and time spent with their loved ones.
And then what is the admissions process like?
Our admission process here at Southwest Medical Hospice is pretty simple. Once a patient decides they want hospice, an admission nurse will meet with the patient and their family and/or their loved ones. During this meeting, an assessment takes place and a discussion around their goals of care and determining if hospice is the appropriate level of care.
So some patients are on hospice for approximately 6 months, while others may only be on the service for weeks or days. How do later referrals affect a patient's experience?
Late referrals actually undermine the benefit and the gift of hospice. A common scenario that we see is when a patient's given a poor prognosis, but they opt to continue with further treatment. Sometimes that treatment can actually have the opposite effect and has the potential to limit their quality of life. Patients often have a sudden and rapid decline in their health, and they lack the physical and emotional support that hospice can provide.
So tell us about your team. We hear it's a skilled, experienced crew.
Our team is highly skilled at providing quality care that's devoted to a patient's comfort and safety. Studies actually show that when a patient enrolls in hospice sooner compared to those who have similar diagnoses and prognoses actually live longer on hospice.
And is there anything else you'd like to add?
Ultimately, I think that patients want a sense of peace and control in deciding how they spend their final days, and I believe hospice allows them to direct that process. I also want to add that when a patient comes to hospice sooner in their terminal illness, services are more gradual, resources come more gently, and the patient has more time to get acquainted with their care team and vice versa. In situations where equipment's needed, we can deliver it when it's needed and not at the last minute. Our team is also able to make better recommendations on symptom management such as pain and anxiety. We also offer other support services such as social work, spiritual care, and volunteer and bereavement services that are available to the patient and their families.
All right, Anastasia, we appreciate your time this morning and giving us more insight into this. For more information about Southwest Medical Hospice, their info is listed right there on your screen. The number, 702-671-1111. We'll also have this on our website.